Rex had a passion for running. It was something that he enjoyed doing by himself. It was something he enjoyed doing with friends, and especially with family. We never expected that cancer would affect our lives in such a personal way. We knew others who had cancer. Rex was running marathons at the time and seemed to be the picture of health. And yet cancer did touch our lives. The diagnosis of his cancer was first made in the summer of 1987. The progression of the cancer was quite rapid, and so within a matter of days after the diagnosis, he was no longer able to run. After the very first frightening moments of diagnosis, almost immediately, hope came into our lives, and it came in the presence of the research that was being done.
Give to the students of this institution the vision of making a significant contribution to the discovery of a cure for cancer. This was the charge given by President Harold B. Lee to Brigham Young University. Through outstanding faculty and research, some of the most talented and dedicated students in academia today will make a contribution to curing cancer. The mission of the Brigham Young University Cancer Research Center is to do cutting-edge cancer research, leading to treatments and cures for this collection of diseases that we call cancer. Our unique focus is that we extensively use undergraduate students and prepare and train them for careers in cancer research. Students who train at the Cancer Research Center can participate in any of the laboratories in the center. There they may work on projects as diverse as synthesizing a new chemotherapeutic drug, searching for and finding an anti-cancer agent in plants, or studying the biochemistry or genetics of cancer. Through this experience, they will be trained to enter the very best research programs in the country.
He was always so very optimistic. That was just part of his character. And part of his optimism had to do with research. Rex would be so delighted to see the progress that is being made today at Brigham Young University in the area of cancer research.
One of the biggest problems with cancer is catching it before it spreads throughout the body. Therefore, it's important to catch it at the earliest stage. In our laboratory, we've developed a test that aids in the diagnosis and prognosis of cancer. We can take a pinprick of blood and measure certain levels of a chemical that is released by cancer cells. By measuring the levels of the chemical in the blood, we can determine how aggressive the cancer is, and also as the patient goes through therapy, we can determine how the patient is responding to that particular therapy regime. And in the near future, we hope to be able to use it for early diagnosis as well. If this test goes on the market and saves one life, then I think it's all been worth it.
We were so very grateful that we had such a long extension of Rex's life because of the research that was done. As we progressed over this 9-year period, there were new things that would prolong his life. We felt like we had a new lease on life, that we had some precious moments that we could share together now as a family, that we weren't sure there for several months that we were going to have.
One of the most troubling aspects of cancer is its ability to reoccur, especially after a seemingly successful round of chemotherapy. This is because cells within a tumor very often become resistant to the therapeutic drugs. The main way that this occurs is through the production of a cell membrane protein that functions as a drug pump. This protein can bind to drugs and pump them out of the cells. As the level of this protein rises within a cell, the cells become progressively more resistant to the therapeutic drugs. Our work focuses on the design and synthesis of new compounds that can bind and inhibit this protein's ability to pump drugs out of cells. Our goal now is to further increase the potency of these compounds in an effort to find new clinical candidates. Students are actually making the compounds. Hopefully, through this work and that of others, in the near future, resistant forms of cancer will be overcome.
He ran most of the time during his cancer. I believe it was sometime in 1993 when he was immobilized to the point where he could no longer run. He walked for quite a while, and then he just became our coach. And I used to ask him in the morning when I would leave to go run, is this really okay? Would you rather that I stay here? And he was so wholeheartedly in favor of my continuing to run and wanting me to run with the children or go out and get exercise in the morning, that he was very enthusiastic about it. And he would just say, go out and run for me. If I can't do it for me, and I can get the enjoyment from you running, just watching you out the window and imagining what it feels like. We never know how cancer is going to affect us, but chances are it will. We all have an opportunity to participate in cancer research, which leads to the discovery of new cures. The work at BYU is definitely accelerating. This research can prolong and even save the lives of those we love.
The researchers and students of the Cancer Research Center share the vision that cancer can and will be cured, and that we can make an important contribution toward finding a cure for cancer.
The work might seem daunting. The finish line may seem distant. But together, we can win the race against cancer.